Hi everybody, it's me, it's Dr. Kestler from Lorain County Community College with today's co-video. Today's May the 4th, and may the 4th be with you. It is Star Wars Day. My temperature today is 96.3, and just real quick, which is Fahrenheit, which means I'm checking for my fever. For those of you who haven't been following along the whole series, that's what that's about. And trying to protect ourselves by checking for any kind of fever. Also washing my hands, and you can see me in this picture wearing a face mask. I will continue to push for that kind of a thing as we go forward. One of the things that, this is kind of a summary of some stuff that I've already presented, but I just thought this was a really nice graphic that a colleague shared with me. And it shows you that the virus does get around. It's getting around the world, and one of the subjects I want to dive into today is it does not seem to be getting around the world in quite the same way. There seems to be some differences, and I want to dive a little bit deeper about how it is being spread. But you can see here is the various strains of virus that have been coming to either America or coming to Iran or coming to Italy, and you can look at them by color coding where they have been, and of course they all come back to where they got started in the Wuhan province in China. One of the things that I have to tell you is that, we all are, first of all, we're all opening up. We know that. We're all getting out. I went out to Starbucks today wearing a mask and having precautions, wiping my doorknobs and my steering wheel down, washing my hands when I came home. And as we get going here, we are kind of flying a little bit blind. And so, one of the things you should assume is that everybody is infected, including the people who aren't wearing the masks. And so the people who aren't wearing the masks, you should especially keep your distance from. We are by no means through this yet, and again, we're still waiting for more testing. You can see here the FDA is kind of putting a little bit of pressure on the companies that are selling antibody tests to make sure that they're working and make sure the data is working, because if they're useless tests, that they're just taking money from you. We need to be able to make absolutely positive that when you run a test that it actually gives you correct information. False positives are when it tells you you're positive when you're not. False negative is when it tells you you're negative when you're not. So we want to make sure we get the most accurate kind of testing so that we can move forward and make predictions. I want to return to a subject that we have been toying with, and the information continues to evolve about COVID-19 as we go into this and further and further. And one of the things that people were musing about was whether there was an effect of blood pressure drugs, since one of the ways that the virus can get inside of cells is through one of the receptors that is involved with manipulating blood pressure, and if people are taking inhibitors of that receptor, then perhaps they would fare differently. And the fact of the matter is that some recent data looking at a lot of people, that's 12,000 people, that they examined who are on blood pressure medicine, there was no real difference in the group. So they're confident in saying that blood pressure medicine is not something that will adversely affect people. But we still don't know all the answers. There's some really bizarre stories that are going on. Like, let me tell you one. There's a lot of cases in the Dominican Republic and very few cases in Haiti. They're on the same island, and there's just a border between them. And both of those, and there's a very different story between the two places. Why is that? We're working on that. We don't know. For instance, Iran is another place where there is absolutely a disaster. It's in the top 5 countries, I believe, or at least the top 10 countries infected with COVID-19, and including deaths and infections. And right next to Iran is Iraq. And Iraq has very few cases. Again, we don't know why that is. That's something that we're looking into. One of the things that people are examining in a kind of very serious way is there's a very funny vaccine that has been around since the 1920s, and it's called it's for tuberculosis. And this country, we do not regularly use this vaccine. In other countries, they do. Was originally created at the Pasteur Institute in France in the 1920s for tuberculosis. And it's got some bizarre, the vaccine itself has got some bizarre properties, and they've been looking at it in a number of diseases, past tense, before COVID-19, and virus infections and such. And there's an ongoing push, so much so that there's a number of studies going on right now where they are vaccinating half the people in a group in Australia, physicians and healthcare workers. They're vaccinating half the people with this vaccine, the tuberculosis vaccine, the Bacille Calmette vaccine, and half the people are getting a placebo vaccine, blind. They don't know who's got which one. They don't know if they've been vaccinated or not, and they're going to try to get an answer to whether there is an effect. Here's a very old picture that I pulled off of the internet of the vaccine being put together in vials to be shipped around. So whether this is going to be something that is beneficial, we should be able to figure that out fairly quickly, on account of because the vaccine is being used in many parts of the world, and we should be able to take populations of people and compare them to other population people who do not receive the vaccine and see if there's any story there. Again, maybe this has something to do with some of those places that are not experiencing the disease the same way as everybody else. But very clearly, I want to just show you a couple things here. I'll just finish on this one. This is from Ohio, and they've just changed some of the data that they put out in Ohio, and that they've looked at, instead of 5-day trends, 21-day trends. And you're looking here on this data at cases, deaths, hospitalizations, and then ICU hospitalizations, which is the more serious one. And I kind of see, to me, there are some spikes and there are some valleys. There are some peaks and some valleys, but I see mostly flatness. So it seems to me that we're in the plateau. We're in the beginning, and it could go either way. As you know, we could reach another mountain and go back up again. We could hit another storm, or we could be through the storm. I'm hoping that we are through the storm. That's obviously what we all want to hope for. But nevertheless, I think we all need to be very careful, especially as we on distance. We need to take a lot of precautions. Remember, I haven't mentioned washing your hands in a very, very long time. Keep washing your hands. It is. I've spent my entire life developing disease preventions, and there is nothing on earth better than washing your hands. Penny for penny, it is the best return on your buck. And then there's that face mask. I'll put this picture up again, and just to let you know, this is how I move about in public, and you should too. It's the best way to protect yourself. All right, I'm going to stop right there, and hopefully you'll have a good, beautiful weekend this weekend. And hopefully you'll have a good evening tonight. So thank you all for tuning in. And let me just say, be good to each other, and may you persist like a lentivirus.